Hello dear friends, my name is Dr. Igor Atabekov. I am a clinical oncologist practicing since 2010. And today we are talking about radiation dermatitis. This is the very common complication of radiation therapy. Radiation therapy is when we use radioactive beams in order to destroy the tumor or metastasis. The thing is, when the beam comes to the tumor somewhere inside the patient from the device, it goes through the skin and the skin will be affected by radiation. It will happen in up to 95% of this type of distant radiation therapy. And it can be acute, starting during radiation therapy and within 3 months, or chronic months or years after radiation therapy. It causes, of course, inflammation, damage to DNA, damage to membranes, edema, some redness, and after some time, when the dosage is already accumulated dosage is about 30 gray, you know, they do the sessions 1 day, 2nd day, 3rd day, 4th day, and this every day the patient gets some dosage. And then it accumulates, and in general, when it's about 30 gray, about 2-3 weeks, then the next changes will happen. Not only edema and some redness, but also it can be hair loss, it can be some dryness of the skin, the blood vessels will be damaged, there can be some pigment changes, some darkening of the skin sloughing out, and after 45 to 60 gray, like 4 weeks, 5 weeks, the new changes may happen when there is a more deep damage to the skin, to epidermis, to the basal level of the skin. There deeper erosions may happen with some liquid going out, with some fibrin, the whitish thing in this liquid, and this is already a more serious complication. It doesn't happen in everyone, but this is a possible steps of dermatitis development. So there are some risk factors for more hard, more severe cases of dermatitis. These are some genetic defects of DNA repair, like, for example, defect in ATM gene. It can be diabetes mellitus, obesity, advanced age, female gender, it's chronic sun exposure. Somebody likes to sunbathe and often gets burned, red skin. These are the people who are at higher risk. Also smoking and receiving chemotherapy or targeted therapy are also the risk factors for more severe radiation dermatitis. So, what are the general measures for everyone who is starting radiation therapy? First of all, the patient needs to maintain the area of radiation dry and clean. Don't use anything harsh. Do the daily washing with a warm, clean water with neutral pH soap, not acidic, not alkaline. Because even just washing will help with itching, with redness, and with sloughing out of the skin. Next, using unscented lanolin-free water-based moisturizers. Very important, don't use any moisturizers, any ointments, any dressings before the radiation session. Very important, otherwise it will increase the accumulation of radiation at the skin level and increase the damage. Next, avoid skin irritants, mechanical skin irritants, meaning some coarse clothes, zippers, any jewelries at the area that may mechanically damage the skin. So wear loose-fitting clothes and avoid different chemical irritations like perfumes and alcohol-based things, different aroma oils, avoid baby powder in skin folds, and avoid sun exposure. This is about prophylaxis. What else can you use for prophylaxis? You can use topical steroids, glucocorticoids, For example, these ointments. For example, this ointment that can help with itching, and also it can help to decrease the risk of severe dermatitis. Meaning glucocorticoids, they don't totally stop any dermatitis or prevent it, but they help to make it less severe. Also, there is one more treatment. It's low-intensity laser therapy and olive oil. Olive oil has a lot of antioxidants, omega-3, and in general it helps to as a prophylaxis. By the way, there were some randomized studies on humans that checked calendula ointment, and it showed that calendula doesn't really help to decrease any severity of dermatitis. And when they checked aloe vera gel, they understood that the usage of this gel increases the risks of severe dermatitis. That's why aloe should not be used in such patients. Very interesting, because usually we think that, okay, aloe is something for healing, for regeneration, but here, as you see. So, dermatitis of grade 1, the mildest dermatitis, just some redness, some sloughing of the skin. What can you do? You can just wash it, as we talked about. You can just use moisturizers without lanolin 2 to 4 times a day. Don't use anything before session. You can use glucocorticoids to decrease the possible severity of the dermatitis. And you can use olive oil. Keep it clean and dry before every session. If we're talking about dermatitis grade 2 or 3, when there is some deep erosion, when there is some liquid coming out, then there is always the risk of infection. That's why not only washing, but we must think about the infection prevention, prophylaxis. We must use only proper dressings under the surgeon's monitoring. Usual dresses may be stuck to the wound, and when you change the dressing, it will damage the wound. That's why they use silicone-based dressings. Also, some use their proteolytic enzymes like papain, for example. I was talking about papain before, that it's used a lot for wounds, for dressings, for GI problems, for example. It helps with digestion of proteins, and it helps with cleaning the wound. That's why if you did not see my video on papain, please watch it. Also, there are some ointments that can help with regeneration, like methyluracil, sulcocereal, zinc ointments, but they don't help against infections. That's why you may need the ointments with antibacterial action, like a silver sulfadiazine, for example. There are also some combined ointments with antibiotics, or even taking antibiotic pills or injections. And when we're talking about dermatitis of grade 4, we of course need the help of the surgeon, specialized surgeon, who will debride, remove all the dead tissues from the wound, and use the techniques to cover it with the skin, so this wound will heal. Dear friends, thanks for watching this video. I hope it was useful for you. I would appreciate if you write any comment under this video, maybe just wish something good to the others, or share your experience. And if you want to support this channel, there are links under this video. I wish you good day, good health, and good luck. Bye. See you in the next videos. Don't be